Parker handle. It is basically a handle only. It's not a scalpel. And there is no such term as knife. Knife is used by criminals. Surgeons use scalpel. Okay? So, this is a Bart Parker handle. You can see that there are fenestrations here. Any instrument with fenestrations would mean that that's where you hold it. If you hold anywhere else, that's a modification of your technique, which you can do. Now, before this, it used to be a fixed assembly, one. And what would that mean? Each time you have to autoclave it as one. And when you autoclave it, the sharp things become blunt. So we'll have a shorter life. So somebody devised this handle, and on this you can slide on a blade, like you do in the shaving kit. Earlier days shaving, I mean you have those disposable shaving sets, but they have a life. The wrapper, it opens up nicely without any hassle. Can you see that? This is how you load a blade on the handle, and I'll ask you to do it when I ask you. Before that, please don't do it. And use some instrument to now take it out. And don't use your hands to touch it. You can use the forceps. It will take a little longer for you today, but don't worry. And go across so that it is steady. You slide it in. It sits in with a nice click. And if I have to remove it, what do? I hold the rear end and I just loosen it. I don't take it out in one go. I'll get close to a place where I need to throw it before I remove it. This is to indicate that sharp objects should not be handled lightly. Three major grips of holding a scalpel. One is a typical palm grip, where you hold between the middle finger and the thumb. Anti-fenestrations. Let it slide into your palm. And use your index finger right on the top of the blade. And the sharpest part. Which is the sharpest part of the blade? Louder? Louder, louder. Belly, good. Not the tip. This is the belly. That's a tip. Belly is the sharpest part of the blade. And that's what you try to put on the skin when you're making an incision. The belly on the skin. I'll try to shift my angle so that you can see. So I keep the belly on the skin at an angle of 45 degrees. And remember, a scalpel cuts from a point to your left to a point on your right. And scissors is just the opposite. Left to right, away to close. This is scalp. Can you repeat that loudly? Brilliant. So that is scalp. Scissors is just the opposite. If you go the reverse way, you're doing the reverse way. And what do at the other end? I do a little bit of palm flexion to make sure that my incision does not tail off. Otherwise, what will happen is, you made a big incision in the skin, smaller in the fascia, further smaller in the peritoneum or somewhere. So you create what is called a funnel, and that's called funneling of an incision. If you're asked a question, say in U assembly or in flap, funneling of an incision is the result of faulty technique. So you made a big incision for patient to see, but you have small opening inside for your excess, for raising flaps or for dissection. So when we are doing that, we use the portion between the tip and the belly. And then my grip has to change. Because if I hold it the classical way, palm way, my elbow will get into my tummy. So I will be restricted by myself. So what do there? I use a paintbrush grip or pen holding grip as we call it. So this is the second one. And what am I doing? I am raising the flap using the portion between the tip and the belly. And I'm raising a flap, you can see that. Now, which is superior, scalpel or the scissors? The question is badly framed. Most people believe that scissors is superior to scalpel. Both have their role. But any instrument that has got two blades will first crush and then cut. So when it's crushing, it is creating a dead tissue. When it's creating a dead tissue, it's leaving a focus for infection. So any instrument which has got two blades is inferior to the one which has got a single blade. So no rocket science, scalpel is superior when it comes to just the cutting part of it. But scissors have a role. You're in the depth, you can't take scalpel there. And plus you want to see what you're cutting. It may not be possible with a scalpel. That's where scissors are needed. But they have their limitation and you must understand. Where you hold it like a butcher would hold it. This is for a knife, it used to be with a long blade. I'm using the word knife there, but that is not a scalpel. It was used in the medieval times and before for amputations. I've seen it being used, not that I was in medieval times. The instruments continued. So they were used for amputation. So that, you've got a broader blade, you can cut more. And it was an era of wars, especially First World War or the Napoleon Wars. The story was Napoleon one, besides the others, one more surgeon he had was Bistori. These are the three grips. If you're asked, and if you answer that in the exam, you get a distinction, that's it.